This program was made possible by grants from the John and Diane Laxmi Family Charitable Fund, the Asfar and Maheen Malik Family Foundation, and the Missouri Asian American Youth Foundation.
When it is repeated and it's causing harm to the child, that is totally different than teasing.
Hi, I'm Aisha Sultan, and these are things we don't talk about. Ahmed is a 14-year-old boy who dreads going to school lately. No one wants to sit with him at lunch. One of the popular kids makes fun of him. He's too embarrassed to tell his parents, and teachers don't really do anything about it anyway. It started when he transferred to this new school a year ago, and it's gotten worse. He's heard derogatory comments about his religion and ethnicity. A group of peers physically intimidated him. These incidents often occur in the school hallways and during recess, away from teachers' eyes. It makes him feel unsafe at school. His grades have declined, and he frequently complains of headaches and stomach aches to avoid going to school. He's become more withdrawn. His parents notice changes in his behavior. He's more irritable. He's really reluctant to discuss his school day. I'm joined by child psychiatrist Dr. Afshan Sultana and Alex Davis, a psychiatric mental health nurse practitioner. They're going to help us figure out a plan for Ahmed in this hypothetical situation. Hi, guys. Thanks for joining me.
Thanks for having us on your show and giving us an opportunity to this important topic, things we don't talk about. And being a psychiatrist, I feel that there's a lot of stigma around mental health, and these are the topics that people are reluctant to talk about. So thank you for doing this.
So what is the best plan for a child who comes to you who's in a situation like this, Alex?
Yeah, fantastic question. I think the most important thing is when your child presents with concerns about bullying is controlling how you react. As parents, we want the best for our child. And sometimes we can respond with a lot of emotion. And so sometimes being able to regulate that emotion, empathize, really listen to the child and begin to gather that information can help us know what next steps.
Dr. Sultana, what are some things a parent can say if they suspect? What are ways to ask if something might be going on at school the child doesn't want to tell you about?
So the best way is if you have to have a good connection with your child. Because if you have a good connection, then they will feel safe to come to you and open up to you if something is going on with them. A parent can notice things like child's behavior is changing, moods are changing, academic performance is changing, and that could be some of the signs that they could see something is going on.
When people come to you, what kind of presentation do you see in terms of what finally brings them to your office?
So usually, either it's the change in mood, stress levels being high, change in mood, academic performance getting affected. So those are the things that mostly they present with.
And when you see people come to you to talk to you, is it normally the parent that leads the conversation, or do you try to start with the child and ask questions? And how do you get to what do people want to talk about this openly?
Great question. A lot of times they do not want to talk about it openly. With the parents, they'll be able to provide that additional information. Sometimes the kids may not want to share because sometimes there can be a little bit of guilt with bullying. And that's something that I always acknowledge during those appointments, that they did absolutely nothing wrong for that bullying to occur. So I talk with both the parents and I talk with both the children separately.
Oh, interesting. Dr. Sultana, why would a child feel guilty if they're the ones being bullied by somebody?
That's generally seen in anybody who's a victim, a trauma victim, that they somehow feel that they did something to trigger that kind of behavior in the other person. So that's probably where the guilt comes from.
And what type of interventions do you start to recommend? Like, do you go to the principal? Do you try to talk to another parent?
So, there are different ways to approach this, of course. Starting with the child, I would recommend that the parent would sit down with the child, understand what's going on, who's bullying there, what environment it's going on, how many people, and then validate their feelings, that they're feeling frustrated in that situation they are.
Like, what about a parent trying to reach out to another parent? Is that advisable, unadvisable?
So yes, they should. So depending on what the situation is, they should reach out to adults in that situation. If so, they can. If the bullying is occurring in school situation, then they can reach out to teachers. First, I think the parents should encourage the kids to advocate for themselves, speak up. Maybe reach out to the bully. If it's a simple verbal kind of bullying, they may reach out to the bully and speak up about how they made them feel. And if that's not helping, then of course they need to reach out to their parents, their school teacher, school counselor, principal, whoever adult is available.
Alex, do you think that there are kids that are scared that if they tell someone, it's just going to make it worse?
100%. Yes, they are a lot of times concerned about if I bring this up to my parent or bring it up to a loved one, or am I going to get bullied for that? Or more kids going to bully me? So a lot of times when those concerns are expressed and I have an opportunity to encourage the parents to talk with the teacher, because a lot of times parents say, you know what, I'm going to reach out to the principal because of this behavior. And I always kind of encourage them, well, maybe before escalating to that high, can we talk to the teacher in the classroom? Because the teacher in the classroom will be able to provide a lot more context. And then if we're not feeling that the problem is being addressed, then of course you can always go up, whether it be the principal or superintendent.
Dr. Sultana, I know technology has changed the way that bullying happens. Can you tell me a little bit about how it's changed, how kids experience bullying?
So yes, in this day and age, cyberbullying is very common. Mostly teenagers, when they're of that age that they're engaging more and more in social media, friends following, and so at that time we have noticed that the cyberbullying could be in form of text, social media, and that follows them home. So there's no break from it. And so usually what we recommend for them to do is at the teenage level, of course, is to not engage with these kind of behaviors, block these people. But before you block them, take pictures and collect evidence of cyberbullying. So if they have to reach out to the telephone services or social medias, so they can have, something done about it. Yeah.
That's great advice. And so are there situations in which, I know that we don't like to say just ignore this or just ignore them, but is that ever a place to start?
Yeah, I think there's a fine line in between bothering and bullying. And a lot of times that it can be challenging for a parent to know when is bothering, when is bullying. And I would say when it is repeated and it's causing harm to the child, that is totally different than teasing. There can be acceptable teasing that maybe as a parent we perceive that as, oh, is this bullying occurring? But if the child is not perceiving it and we're checking in with the child and they're not concerned, I would say that is not an instance of bullying. Great question.
I would say the same. Well, basically, bully is looking for a reaction. So if it's an annoying comment, one time, like he said, bullying is a repetitive behavior to hurt you, to hurt your feelings. If it's a one-time event, simple comments, annoying to you, teasing, I think it's okay to not engage with that, let it go, because you're not giving the bully an opportunity to get a reaction out of you. And then they will leave you alone for the most part. But even for the first time, if the bullying, if it's not a repetitive one time, but significant severity, you are physically threatening someone or engaging in a fight, then yes, you need to respond by by talking to your adults and teachers.
So what happens if a child is being bullied, they don't want to really tell their parents, and they just let it persist and keep feeling worse and worse about themselves? In your practice, in your experience, what kind of outcomes have you seen when it never gets addressed?
So usually the presentation is in the context of anxiety or depression, that my kid is, he is not engaging with us, he's withdrawn at home, he is talking about life is not worth living. Those are very, serious comments, and parents are, rightfully worried about it. So they would bring it to my attention as a child psychiatrist, what's going on, he's depressed. Panic attacks can happen, severe anxiety. Sometimes they bring them in context of academically. Maybe they're not aware. Some kids can be quiet. and they don't show too much emotion. So in that instance, the academic performance may be, going downhill, and that makes them feel like, what's going on? He was always a student.
Do they ever learn through the process of bringing their child to you that they didn't know before the child was being bullied?
Yes, that happens a lot of time. Again, it depends on the personality of a child. If a child is sensitive, quiet, not expressive, they might not know. And then when they find out, they're really, worried that how, and they feel guilty that how come we didn't know about that?
Alex, is that something that you've seen? How does it present in your practice?
Yeah, in a lot of similar ways. I feel like I see a lot of avoidant behavior, or just more isolated, more withdrawn. The parent will notice that their child is just not engaging in the same extracurricular activities. They're maybe not engaging in sports, or suddenly they don't want to go to school as much, or maybe they're acting like they're more sick, but they're not running the fever. Mm-hmm. And it's a departure from maybe the child that we typically see. And a lot of times, maybe if after they use a computer or after they return from a social event, if they're distraught, that can also be sometimes a clue that maybe something's going on with a relationship.
Oh. So younger kids, when they are presenting, they're mostly like school phobia. They don't want to go to school. They will have a fight in the morning to go to school. They will complain of tummy aches, headaches, or even if they make it to school, they're gonna, they will call the nurse that we're sick, and they'll be sent home. And there are different ways to handle that. Of course, you have to, use the treatment strategies like medications or therapy, mostly therapy. But at the same time, sometimes it helps. It has helped. I don't know, this might be controversial, but it has helped that when these kids were taken out of the school environment, if that's where the bullying was going on, all their anxiety disappears. They are flourishing, enjoying life. They're doing online school, and something that has happened. So there are different school of thoughts regarding how to approach this.
I'm so glad you brought that up, because I think if you've tried many different options and still your child is suffering, parents need permission to know that it's okay just to take them out of that situation. It might save their life. Do you agree?
100%.
Absolutely.
Yeah. And so can you give us examples of bullying situations that parents might not have any clue were going on, or that actually happen? And maybe they didn't happen back in our time, but there are things that you see now.
Yeah, that's a great question. There's been times in my practice where I've seen, children present with bullying concerns that the parent thought that person was their best friend, when in reality, this person is putting them down. And it seems like they're close friends, but a lot of times maybe they're trying to appease this person, or try to make this friend worthy of their approval. And so sometimes when we have those discussions, especially one-on-one, we can start to discover trends that, some of the feelings of being sad or feeling a lot of anxiety, it's when we're hanging out with a certain person. What is this relationship with this person? And then sometimes we can explore that with the parent.
Oh, that's great. Dr. Sultana, what are ways in which you've seen bullying come out that people have told you about in your practice that might be surprising for parents to hear?
Yes, definitely. From a close friend, they had long-term relationship, friendship, and eventually when the child speaks up, it seems like it was one-way relationship where that friend was a bully, and as long as he was following, appeasing the bully, it was good. But but if he doesn't, or as with time he learns, he needs to stand up for himself. And when he does, then the relationship goes south.
So how common is bullying actually? Because I feel like we hear about it a lot. Is it really more prevalent? I feel like kids have always been mean to each other. Can you talk a little bit about how bullying, the prevalence of it might have changed?
Yeah, the prevalence of bullying, I feel, has only increased. And I think that increase is due to social media. Phones, tablets, it's hard to escape them nowadays. And so what that means for the child is that they have constant access to possibly someone bullying them. Or even if they're not engaging on that device, they're thinking, if I pick up that phone, if I pick up the tablet, there could be someone saying something not nice about me on social media. And so that alone can cause emotional distraught. And I think because of that, bullying's more, and it's easier to do than ever, unfortunately, for the bullies, because they can do it from their home.
Yeah. What do you think, Dr. Sultana?
Yes, I mean, I agree. It's more prevalent because there is an access. You cannot leave the bullying at school and go home or go to summer break. It follows you, and the way these bullies have the ways they have used sometimes can be very, very cruel. I mean, most of the time, of course, it's cruel, but it could be very, very cruel to the extent that they would, tell the kids to go hurt themselves or go kill themselves, which is, extremely serious.
I don't think a lot of parents know that there are actually people on the internet, even if your child is just sharing their information with a circle of friends, who could put in the comments or send them private messages that tell them you should kill yourself because you're ugly, because you're this, because you're that. And like you said, we didn't experience that once we left school. One thing people say to me is, why can't kids just turn it off? Why do you have to look at your phone, or why do you have to be on social media? How do you respond to that?
We have to, I mean, this is the new era, new age, and I think we all use our phone for multiple reasons. So we cannot tell them not to use it, but we can definitely help them realize what are safe digital practices. Make sure who are you contacting, who are you talking to. Don't give personal information out. Don't click to unknown links, things of that sort.
Yeah. And, just being a great representation in the home of appropriate electronic use. If a child sees you constantly on the phone and then you're saying, hey, stay off the phone, they're gonna take that with a grain of salt. So, even, looking at ourselves and how hard is it to put our own phones down? And imagine how more challenging it is for our children who, are engaged in social relationships and being a preteen or teenager. It's very challenging to put that phone down.
I've read that for the generation that's grown up with these devices and social media, that the interactions that they have online are just as real to them as you and I sitting here and talking, as in that relationship is just as important to them. So when you ask a child to just cut themselves off of all social media, you're kind of asking them to cut themselves off from their social life. Is that accurate?
I would say it is. In many ways, especially with virtual learning and just ever since the pandemic, with the explosion of just telehealth and everything being more electronic, if we kind of eliminate a child's source of communication, it's going to make them feel more withdrawn and isolated.
Oh, that's so interesting.
Yes. So I think we have to focus on, again, safe digital practices, rules around social media, who are maybe sometimes parents can friend our own kids. We can friend our own kids so that we monitor what's going on if you're worried about these things. And of course, there should be I've seen very young kids also on social media. I think it should be based on maturity level, not age. Like maybe a 14-year-old is not as mature, then they should avoid that. But monitoring that social media, friending them and monitoring what's going on, I think that would be also helpful.
Yeah, sometimes I feel like it's hard for parents to even keep up because social media keeps changing, the apps keep changing, and we might not be as familiar or even know how to monitor it. Do you think that children are more likely now to try to confide in a parent, or maybe that they're less likely from when you started seeing patients in your practice about issues of bullying? How do you feel like that parent-child relationship has sort of evolved over time?
So it depends. I think it all depends on the kind of connection you have with your child. It comes down to that. If a parent is, of course, all parents love their kids, but are they attuned to them? Do they pay attention what's going on? Can they pick on, little signs? So depending on that, and then it also goes with the personality of the child. The parent-child personalities may be different. If a child is sensitive, quiet, not expressive, and if the parent is not attuned, then, they will miss that. But if they are, but if the if the parent and if there's a good connection, then child may feel safe enough to come and tell the parent. So I think I don't know if there's a prevalence or a change in if they tell or not. I think it's basically based on the level of connection they have. It could be parent or it could be any other adult in their life who they see as a safe figure.
Right. That's such a good point, because if you don't feel comfortable telling a parent about something, you can talk to a family friend, you can talk to a teacher, a school counselor. There's a lot of other coach or somebody that you can confide in. Is there anything in a person that could make them more vulnerable to being picked on, Alex?
Yeah, anything that, kind of separates them from the group. So that can be, if it's a predominantly, a Caucasian school and they're African American, that can put them more at risk for being discriminated against. If there is, challenges at home or, or just how wealthy their family is. Sometimes kids can find anything to be cruel about, unfortunately. So,
well, that's true. In your practice, have you seen that there are certain situations in which bullying is more likely to occur?
Yes, like Alex said, if there is some sort of a difference, I feel kids who are, again, quiet, sensitive, not expressive, or they lack some social skills, then in that case, they're more likely to be picked on because they're not able, and then sometimes kids with low self-esteem, they're not going to advocate for themselves or speak up, and that's when they could be targeted.
So I want to talk about something kind of hopeful related to this, because a lot of parents worry about their kids being bullied, and they worried about them being able to help their kids if they're in a bullying situation. How often, when they get one of you involved, are you able to help resolve or improve someone's situation who is being terribly bullied?
Yeah, I'd say that when a patient comes to my practice and a parent is concerned about a bullying situation, we can always strategize. And I think that when it comes to strategizing ways to kind of resolve this issue, making sure the child is a part of it, because the child needs to be able to build some of those decision-making, critical thinking skills. And the more that they are a part of this decision-making process, the more successful it's going to be. If it's more me and the parent talking about what's best for them, they're going to feel not validated and not heard. And I think that's a huge, huge part of this. So I would say that in my practice, I've seen lots of success, and a lot of that success comes from, the child themselves being a part of it.
Oh, that's great to hear. And Dr. Sultana?
So, I also want to say, when we are talking about bullying, we automatically think of children, right?
Yes.
Bullying can happen to adults too, in that workplace and relationships. So it's a very common phenomena. I just wanted to say that. When it comes to the how to address or help the child, I guess, yes. Again, sitting down, asking what's going on, and definitely encouraging them to problem solve. How would you want to handle? And that also gives them the control and the confidence that I have a say and I can handle, because sometimes kids are very anxious that if you are going to go, confront this kid or parent, then it can worsen for me. So you have to encourage them. How do you want to solve the situation? In certain cases, they'll say, this is my friend, I can talk to him, let them try. In certain cases, they would ask for help. In any case, a child is a child. So you are the parent at the end of the day. You can ask them how they will feel comfortable, but depending on the situation, severity of situation, you will do what a parent will do if you need to reach out to a teacher, school, principal. And in my experience, sometimes schools do not do enough. And in that case, what do you do? In that case, you can reach out, you can find out what are the state education laws are. And then you can reach out to superintendent of school. You can reach out to the state education department and say, this is what's going on, and the school is not doing enough to meet our what we expect them to do.
Oh, that's a great point. Alex, do you feel like empowering parents to go beyond, you tell a teacher and they're just like, it's fine, it's under control, and you can tell your child is still not fine?
Yeah, oh yeah. That is something that I experience, quite often, again, in my practice. And there's things in schools called individual education plans, or also known as IEPs, and those are meetings that the teachers and the staff at the school have with the child and the parents. And I would say that those are great times to address those concerns. And as she was just kind of mentioning, with all these amazing kind of regulatory bodies that, look over this, if it's confusing, you could always get educational advocate. You can go online, go into the internet browser, type in educational advocate near me, and you can get someone to come with you to the school to make sure that they're advocating.
I did not even know an educational advocate was a thing. I thank you for sharing that. I had no idea that you could just Google that and hire someone to come with you to help you advocate for this, for what your child needs. Excellent. Well, thank you guys so much for joining us. And if you are feeling bullied or know someone who is going through bullying, I think the important message is that you can get help, you can improve the situation, and we should take it seriously.
Not engaging in the same extracurricular activities. They're maybe not engaging in sports, or suddenly they don't want to go to school as much, or maybe they're acting like they're more sick, but they're not running a fever. And it's a departure from maybe the child that we typically see.